In our previous video, we talked about how the same Medicare plans from the same insurance carrier with the same name even can really be almost completely different from each other simply by the fact that they are separated into two different counties, specifically in San Diego and Los Angeles. Now, those plans that we talked about, the Scan Classic, are run-of-the-mill plans. They are plans that anyone can apply to, and they are both great. But today, let's talk about how benefits can change from one plan to another, San Diego and Los Angeles again, but for a plan that is specifically designed for those folks who have special health conditions, primarily diabetes or heart disease. These are special needs plans, and today we're going to be talking about the differences in San Diego and Los Angeles of the Scan Balance CSNP Special Needs Plan available right now in 2025. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know has questions about their Medicare options, even during the AEP or really outside the AEP or all year round, please feel free to reach out to us at the information down below, and either myself or somebody from my team will be happy to assist over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So what is a special needs plan? Well, it's a plan that is specifically designed to fit the needs of those Medicare beneficiaries who may have some of the most common health issues that are chronic in the United States. Predominantly, in this case, diabetes, prediabetes, or insulin-dependent diabetes, and the whole family of diabetes, or cardiovascular disease, heart disease, or the whole family of heart diseases. Aside from having benefits that are geared to healthy management of these conditions, the additional benefits to these plans and these types of plans is that they will allow folks to enroll into them all year long, not just during the open enrollment period. Of course, to be eligible, one must have one of these health conditions and under treatment for these health conditions and have a medical professional who can verify they have these health conditions, because they will check. But once that gets verified, then the world is your oyster. So starting off, when we look at the Scan Balance plan for San Diego and put that side by side with the Scan Balance plan from Los Angeles, the first thing that I would want to mention is a bit of difference in the two plans, because one of them offers a very, very, very popular benefit and the other doesn't, which is the Medicare Part B Premium Giveback, which we can see here for the Scan Los Angeles Balance plan has a $6.50 per month giveback. Now, what this is essentially is the Medicare health plan putting money back into the beneficiaries' pockets by paying for a portion of their Medicare Part B. Okay, I get it. $6.50 is not much more than a cup of coffee every single month. I mean, not even the super foo ones, right? Like, it's just a normal cup of joe. But hey, it's something, and that makes you $6.50 richer every single month. And if you multiply that out for the year, I mean, that's $70 or so. So something, right? Either way, the Scan Balance plan in San Diego doesn't include this benefit. Moving on to the next benefit is one that I almost always highlight first because it could be the largest expense that a Medicare beneficiary may have, which is going to be the maximum out-of-pocket. Now, this is the cost limit or spending limit on a beneficiary's yearly healthcare spend when they're enrolled in this plan, excluding things like prescription drugs that has their own separate additional maximum out-of-pocket. I know, that's just how it works. But for healthcare services, things like doctor's visits, hospitalizations, emergency rooms, the total cost for that beneficiary for the year cannot exceed the maximum out-of-pocket. And on the Scan Balance plan offered in San Diego, it's at $500 a year. Not too bad. But of course, it's going to be overshadowed by the Scan Balance Los Angeles plan, which has a maximum out-of-pocket that is going to be, I think, one of the lowest maximum out-of-pockets that you can find in town this year at $199 a year. A unique benefit that is on the Balance plan that you won't find on the normal non-special needs plans. And it's an equal amount on both plans in both counties. But I think it's really important to point out is going to be the free continuous glucose monitors. These are those little kind of like they look like dental floss containers that you see some folks having kind of taped to their arms. And what they do, obviously, is they monitor one's glucose continuously. No, but really, they are a great tool for folks who are trying to find the best ways to manage their diabetes. Either way, on the Balance plan, whether it is San Diego or Los Angeles, these CGMs are going to be available at $0 cost. And this is just one of those diabetic-specific benefits that are available on these plans that are, again, developed for those folks who are dealing with that chronic condition. So looking at these two plans, and we've done this a couple of times, in general, over the course of the way things go, the LA plans, the Los Angeles plans, most often always have richer benefits in comparison to the San Diego plans, to their kin from the South with the same names. But there is one benefit, at least on the balance plan, where those folks enrolling in San Diego will have the upper hand over the Los Angeles one, which is going to be on the over-the-counter benefit, or OTC benefit. This benefit is basically a catalog that has everything from protein nutritional drinks to Tylenol and even digital body scales and blood pressure monitors, all kinds of great things. But they give the beneficiaries a budget on a quarterly basis to buy these things in the catalog, but it has to be from the catalog. And in the case of San Diego, it's at $150, but in Los Angeles, it is at $125, so lower. So that means that the enrolled member is able to use these budgets quarterly, and they have to kind of use them or lose them. If they don't use them, they lose them. They have to use these budgets quarterly to buy those things, which again are not a direct savings, so it's not actually putting cash back into somebody's pocket. But if someone was going to buy these things anyways to help manage their health, then why not get some help paying for them anyway? So it is sort of like directly putting money back in their pockets. Also, my personal recommendation for things to buy, 100 pounds of toothpaste. Just always buy toothpaste. Last up today, in our comparison of the San Diego and Los Angeles scan balance plans is going to be an easy one, which is for doctor's visits and specialist visits and urgent care visits. Now, to be clear, primary care is your normal family doctor. Specialist is someone who gets referred to for specific things, in this case, like an endocrinologist, or maybe perhaps a cardiologist, or perhaps a both. In this case, but on the urgent care is where you go when you need stitches, and the wait in the ER is 19 hours long, and you don't feel like getting all caught up on all your favorite Animal Planet shows in the waiting room, Meerkat Manor. That being said, the cost for these services on the balance plan in San Diego and Los Angeles is going to be at $0, which does make it a lot easier to go see the doctor, even if you are probably going to be fine and it's just a scratch. Just kidding. You should listen to your wife and definitely go, because it turns out it spirals into bad things if you don't. So yeah, just get it checked out. You never know. All right, so that's it for today for the comparison between the two scan balance plans, which you can see are going to be much more fraternal twins than identical twins, but it does also show that there can be some pretty significant differences in place. Technically, the same plans, but just because they're in different counties. Also, I think it was a good opportunity to show everybody that these types of plans, these C-SNP plans, these special needs plans that are meant for someone who has specific health conditions, they exist, and they may really have a lot of benefits that are really good for those folks who are fighting those chronic illnesses like diabetes or heart disease in this case. All right, so that's it for today. And if you or somebody you know is struggling to try to figure out what is the best Medicare option for them, whether it is inside the AEP or all year round, please feel free to reach out to us at the information down below. Either me or my team will be happy to help them walk through those tough Medicare choices in person or over the phone at one of our many offices across Southern California in English or Espanol. So, for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.